इमरजेंसी नंबर जला दो ना पापा पास इमरजेंसी जला दो ना
रिकॉर्डिंग हो रही है मेरी बात कोई आया नहीं मैं सारी आवाज good evening class please wait for a few minutes because students are joining the class and first of all today I will take the lecture in English and after that I will continue in Hindi because some students from Nigeria or Sudan they also joined the group or class. That's why first of all I will start my lecture in English and after that I will continue in Hindi. So please wait for a few minutes and after that I'll start my lecture. And dear students, please don't send personal messages. Okay, if there is only one students, no issue. I will start in English and after that I will continue in Hindi. Don't worry. I will explain in both language. Okay. First of all, I want to tell you about the syllabus and after that I will start my lecture. As per your syllabus for PMT 113, Unit number 2 has been covered. In unit number 2, I explained about terms related to your body, like structural organization of body, terms which is used to describe direction, planes, cavities, and at, at last I explained about the anatomical as well as anatomical division of your abdominal cavity as well as your quadrants, which is used by clinician. Today I want to explain about unit number 4, that is study of terminology used in a specific body system, like common medical terms, abbreviations, synonyms used for symptoms, disease, disorders, treatments, and adverse effects of drug associated with respiration, digestion, urinary system, male reproductive system, as well as at the end I'll explain about the skin. First of all, today I only explain about the terms that is used in your digestive system. As per your syllabus, I'll explain about anatomy, terms related to anatomy of digestive system, specific terms related to physiology of digestive system, and at the end I'll explain about the pathological terms which is used in digestive system. Now I want to start about the syllabus about today's lecture, in which I'll explain about functions of the digestive system, which is also helpful in your anatomy and physiology. So it is very important topic as per your PMT syllabus or your anatomy and physiology subject, in which I'll explain about anatomy and physiology as well as pathology. So if I'm talking about objectives are related to digestive system or terminology which is used in digestive system, main objective is to recognize and use terms related to the anatomy and physiology of the digestive system. It means you can recognize and use the terms are related to anatomy and physiology of your digestive system. Second objective of this lecture is recognize and use terms related to pathology of digestive system. First, you recognize anatomy, terms related to anatomy of digestive, terms related to physiology of digestive system, and at the end you learn or recognize the terms related to pathophysiology or pathology. First of all, I start from digestive system or function of digestive system. Everyone knew about that digestive system which provides the nutrients needed for cells. It means whenever you take food, carbohydrate, protein, fats, minerals, vitamins, via oral cavity, that after digestion, that food get absorbed, and that absorbed food provides nutrients to your cells, by which your cells get replicate and form new tissue. So you can say there is several process in digestive system. Number one, ingestion. First terminology, that is your ingestion. It means intake of food. After ingestion, you will say digestion. It means mechanical and chemical breakdown of your food. That is your digestion. After digestion, absorption takes place, and you can say the process of extracting nutrients, or you can say the process of absorbing nutrients or extracting nutrients. And the last one, that is your elimination. It means excretion of waste products from your body. Other terms related to your digestive system, you can use GIT, gastrointestinal tract, that have two main parts, your stomach and small intestine or intestine. And alimentary canal, which refers the function of tube-like nature of majority of digestive system, and that start from your mouth and its end in your anus. So first of all, you will say related to the function of your digestive system, that digestive system provides nutrients for the cell to replicate themselves and form new tissues. This is done via many processes like ingestion, digestion, absorption, and excretion. The digestive system that begins from your oral cavity, or you can say from your mouth, that passes from your thoracic cavity, which is in your mediastinum. In previous lecture, I explained about mediastinum, and that cross diaphragm into the abdominopelvic cavity. And finally, you can say your digestive system exists at the anus. It means you will say an anatomical point of view, your digestive system begins from your oral cavity, or you can say from your mouth. After that, it passes from your chest cavity or thoracic cavity, where mediastinum is present, and it crosses your diaphragm. Then it enter into your abdominopelvic region or cavity, and finally it exists at the anus. Several glands or organs, which is also present in your abdominopelvic cavity, they help or carry out the functions of digestive system, like your liver, accessory organs like your liver, gallbladder, pancreas. They help in digestion of foods. Next one, that is your oral cavity. In oral cavity, normally you can say food enters from your oral cavity or from your mouth. Digestive functions of this cavity is to break down your food. It means you can say after taking food in your mouth, the process of digestion is start, Number one, by breakdown of your food or chewing of your food, that is known as mastication, and after that lubricate the food to make swallowing. Deglutition, it means your oral cavity provide two function. For number one, that is breaking down of your food particles by mechanically, that is known as mastication, and after that lubricate that food which is helpful for swallowing, that is known as deglutition. After that, from your oral cavity, tonsil is very important, and tonsil is your lymphatic tissue which is located or present at the base of tongue. If anyone is suffering pain or tonsillitis, it means inflammation in tonsil. At that time, that person is suffering or difficulty in swallowing of food because of inflammation in tonsil, and that tonsil is lymphatic tissue which is present or located at the base of your tongue and serve protective function because it is a lymphatic tissue and a lymphatic system which is generally, you can say, provide protective function against pathogens or against microorganisms which enter via your mouth. And there is two palates are present. One is your anterior palate, which is your hard palate, and the second one, which is your posterior, that is your soft palate, from the roof of your mouth. Uvula, which is a tag of flesh, basically it hangs down from the medial surface of the soft palate. You can see your uvula which is present or hang medial surface of your soft palate, and that is play an important role for the production of speech. Upper and lower jaw, that is your name as a maxilla and mandible, in general hold approximately 32 permanent teeth, which that 32 teeth are set in the fleshy gums, and that fleshy gums is known as gingiva or gingivae. Gingiva, which is a singular, whereas gingivae is plural, which is that term is used for fleshy gums. Where your 32 teeth permanently set or fix in that fleshy gums. After tonsillitis, or if there is inflammation in tonsil, then this term is known as tonsillitis. Tis means inflammation. Tonsil, inflammation in tonsil, it may be due to invasion of microorganisms or pathogens. Sometimes doctor prescribe azithromycin or antibiotics which inhibit or kill the growth of microorganisms. and sometimes that antibiotic is not effective in case of tonsillitis, then surgical procedure will be performed by the doctor or ENT doctor, ear, nose, a specialist doctor, and remove that tonsil. So after removal of tonsil, that person is more prone to get infected, and after that more precaution takes place to prevent the disease. Next one, that is your throat or pharynx. Before I want to tell you the glands which is present in your oral cavity. Number one, that is your parotid gland, submandibular and sublingual. Parotid gland which is present near to the ear, whereas submandibular gland that is present lower the jaw, and sublingual gland which is present your under the tongue. Parotid, par means near, ot means air, id it means pertaining to, matlab present near to your ear, whereas submandibular that is present in low under the lower jaw, and at last sublingual gland which is present your under the tongue. Throat, or you can say pharynx, and patient may suffer with pharyngitis, inflammation in pharynx. It means you can say that person feeling irritation or itching in their pharynx, by which doctor prescribe cough syrup, and that cough syrup which is providing soothing effect, because at that inflamed area your syrup get provide soothing effect, or get a layer of your cough syrup, by which that person feel soothing effect, feel calm, and reduce the irritation. In case of pharyngitis, it means passage, there is inflammation in pharyngia. This is the passageway. If I am talking about pharynx, it means it is the passageway that connect oral and nasal cavity with esophagus. Pharynx is the connector between oral and nasal cavity of the esophagus, and you can divide your pharynx into three main parts, that is nasopharynx, oropharynx, and hypopharynx. Or nasopharynx is the most superior part of the pharynx. Superior part, it means superior means towards your head. So you can say that the pharynx first part or superior part of the pharynx is known as nasopharynx, and that nasopharynx located behind your nasal cavity, whereas the oropharynx, oral cavity, or it is a part of your throat that directly adjacent to the oral cavity, and the hypopharynx, which is also known as laryngopharynx. Hypo means below, because of its proximity to the larynx, which is the voice box. So basically you can say whenever patients suffer with pharyngitis, it means upper part of the pharynx get inflamed. At that time, doctor prescribe or clinician prescribe cough syrup for relieving that pharyngitis. Next one, that is your esophagus. That means you can say it is a muscular mucus lined approximately 12-inch tube that extend from throat to the stomach. About 12-inch esophagus, which is muscular mucus lined tube like structure that start from your throat to the and end to the stomach. And what is the importance of that esophagus? Then you will say it carries a masticated lump of food. First of all, whenever you take food in your mouth or oral cavity, you masticate by chewing, and that masticated lump of food, or you can say it's a bolus, from the oral cavity to the stomach passes via esophagus by the process of peristalsis. Peristalsis means basically you can say it is a zigzag motion by which your food passes from your oral cavity to the stomach. Whenever anyone is suffering with diarrhea, then you will say that person's or that patient's peristaltic movement is increased. That's why patients suffer with diarrhea. Or if anyone is suffering with constipation, then you can say the movement or peristaltic movement is decreased, by which food cannot passes easily. So esophagus, which is 12-inch in size, tube-like structure that start from your throat and end in your stomach. Generally or basically you can say it carries masticated lumps of food or bolus from oral cavity to the stomach with the help of peristalsis. After that, I want to explain about stomach, because stomach play an important role. First of all, you can say it is sac-like vessels which is present between esophagus and small intestine. Between small intestine and esophagus, there is a structure which is sac-like structure that is known as stomach. Has stomach which has three main functions. Number one, first of all, you can say it begins the process of digestion, or specifically digestive proteins which you swallowed in your food and mixing with gastric juice as well as hydrochloric acid. to further the digestive process chemically. So basically you can say your protein which is digested in your stomach with the help of pepsin or trypsin, whenever the level of pepsin is increased, automatically HCl secretion is increased, or actually you can say whenever the level of HCl increase, your trypsin or pepsin enzyme is more active. If anyone is taking proton pump inhibitor like pantoprazole, ramiprazole, omeprazole, these drugs block proton pump inhibitor, and you will study in your digestive system when you block the proton pump inhibitor, H ions cannot come out from your lumen, where Cl minus is freely present. When H comes in contact with Cl, it forms HCl. So whenever you decrease the level of HCl, then there is a chance to decrease the digestion of proteins. Okay, so stomach, the main function you will say begins the process of digestive proteins which swallow from food and mixing with gastric juice as well as HCl. And when HCl or digestive juice mix with your swallowed food or bolus, it, it is called chyme. Finally, you can say partially digested mixture is moved to the small intestine. First of all, you will say your food or specifically your protein digesting process start in your stomach, and after that you will say swallowed food is mixing with gastric juice as well as HCl, and after that you will say partially digested mixture is moved to small intestine. If I will tell you the anatomy of your stomach, then you will say you can divide your stomach into three parts, three main section. Number one, that is your fundus. Number two, body, and the third one, which is known as pylorus. Pylorus, which is also known as gastric antrum. Fundus, the first part, is the area of stomach which is present below the diaphragm. And this section, this fundus, or you can say the fundus, the section of the fundus has no acid, producing cells. It means basically everyone knew about that a Cl secretion or acid secretion is from stomach, but specifically you can say in fundus or upper part of your stomach there is no cell which secrete or produce acid. Next point, that is your body or stomach's second part, that is your body, which is the central part of your stomach, and the pylorus, which is present in the distal end of the stomach. Distal end, away the joining, that is known as distal. Proximal, it means towards the joining. So the distal part of your stomach, then you will say, sir, that is known as pyloric. Pyloric part, which is the distal part, whereas your fundus, which is the superior part, and the body, which is the central part of your stomach. Pylorus you can further subdivide it into pyloric antrum, pyloric canal, as well as pyloric sphincter. So basically you can say that pyloric sphincter that regulate gentle release of food from stomach into small intestine. मूसा दूर करो मुंह से. Small intestine, the portion of the stomach that surround the esophago esophagogastric connection, which is known as cardia. First of all, in case of stomach, you will say, sir, stomach, which is a sac-like structure, sac-like vessels, which is located between esophagus and small intestine. Generally, basically, protein digestion takes place in your stomach. For solid food, which is mixed with gastric juice as well as your hydrochloric acid, and partially digested food enters into the small intestine. When your food or bolus mix with HCl as well as gastric juice, then you will say it is a chyme. Structure of stomach, then you will say it is divided into three parts. Number one, fundus, so upper part, there is no cell which secrete acid. Second part, that is known as body, which is present central or centrally present. And the third part, that is known as pyloric or pylorus, which is present in distal portion. Further, pyloric, you can say pyloric is subdivided into three parts: pyloric antrum, pyloric canal, and pyloric sphincter. Pyloric sphincter, which regulate gentle release of food from stomach to your small intestine. After that, small intestine, once the chyme has been formed in stomach, the pyloric sphincter relax a bit at a time to release portion of food or portion of chyme into the first part of your small intestine. It means whenever you take food in your oral cavity, by after mixing or chewing, that is converted into bolus and it enters in your stomach where digestion of proteins takes place and it mixed with that food is mixed or that bolus is mixed with gastric juice as well as HCl, then you will say it is known as chyme. And once the chyme has formed, then you will say the stomach's last part, that is known as pylorus, and pylorus last part, which is known as pyloric sphincter, get relaxed or you can say get open and release portion of your chyme into your small intestine or first part of your small intestine, that is known as duodenum. The small intestine gets its name because of its length is about 20 feet, 20 feet long, but we are saying it's a small intestine. Why? What is the reason? Then you will say because diameter of the lumen is very small. That's why the surface area of the small intestine is too much. So you can say most of the drug absorbed from your small intestine because of high surface area. Whenever surface area, if I am talking about surface area, then you will say whenever, one example, elephant or rat, there is 20 rat and one elephant, always you will say small particles have larger surface area, so your small intestine have larger surface area, so most of the drug absorbed from your small intestine. Second part of your small intestine, which is known as jejunum, and the distal part or the last part, that is known as ileum. Villi is also present in your small intestine, and that villi, which contain blood and blood capillaries, is responsible for absorption of carbohydrate, absorption of proteins or digested protein, and villi also contain lymphatic vessels, which is known as lacteals, and that lacteals is responsible for absorb lipid or lipid substances from your chyme. So basically you will say from your small intestine villi is present, villi which contain blood capillaries that absorb food or absorb products of carbohydrate, proteins or digested proteins, as well as you will say villi which contain lymphatic system or lymphatic vessels, which is known as lacteals, that absorb lipid soluble substances from the chyme. So from your small intestine, I said most of the drug absorbed from your small intestine, as well as your food which contain carbohydrate, which contain digested proteins, which contain lipids, which also absorb from your small intestine. The suffix is, which is used for an enzyme, and that means lipase enzyme, amylase enzyme. They are responsible for digestion of proteins, for digestion of carbohydrate, for digestion of lipids. Basically, lipase is responsible for lipids. Amylase is responsible for starch. At the last, that is your large intestine. Large intestine, which is only about 5 feet long, whereas your small intestine, which is about 20 feet long. but the diameter is wider whenever you compare it with your small intestine. The large intestine diameter is wider. That's why it is known as large intestine. And the primary function of the large intestine, you will say, sir, elimination of waste product from your body, and some vitamins also synthesized in your large intestine. But unlike the small intestine, large intestine has no villi, so you can say not well suited for absorption of nutrients. It means you can say from your small intestine, carbohydrate, protein, lipid, or drugs absorb from your small intestine, whereas in large intestine there is no absorption of foods because there is no presence of villi, or there is only, you can say, large intestine synthesize some vitamins and is responsible for elimination of waste product from your body. The colon, the first part of large intestine, that is your cecum, worm-like appendage, that is known as appendix, or vermiform appendix, and directly you can say there has no function seen from your appendix related to digestive system. It is thought to have a possible immunologic defense mechanism. Appendix, you can say, it is thought to have a possible immunologic defense mechanism, but related to your digestive system, it does not play any role for the digestion of food. No longer called chyme, whatever has to seen has not been absorbed from small intestine, which is known as feces or fecal matter. Bolus, which is formed in your oral cavity that enters in your stomach after processing or after protein digestion or mixing of gastric juice as well as HCl. It forms chyme that enters in your small intestine, from where absorption of carbohydrate, protein, lipids takes place. After absorption, your chyme enters into your large intestine, and now no longer it's called chyme. Whatever has been absorbed from your small intestine, now it is called as fecal matter, and that fecal matter or feces passes from your cecum, then colon, ascending colon, descending colon, and after that you can say it enters into your sigmoid colon, and large intestine, the rectum and its junction, which is known as anus, also known as anorectal junction, where your fecal matter or feces held until release from the body completely through external and internal sphincter. It means after passing the fecal matter from your sigmoid colon, your fecal matter enters into your rectum where a junction is present that is known as anorectal junction, where your fecal matter get hold until it release from the body completely through external as well as internal sphincter or is internal anal sphincter. Very important point related to sphincter. Internal sphincter, that is involuntary muscles. It means no control. It is involuntary. Contraction, relaxation, it totally depends upon the fecal matter, whereas your external sphincter, which is voluntary, you can contract or relax. Like your periphery, like your upper limbs, lower limbs, or your finger, you can say it is your voluntary. It means you can stand your hand, you can fold your hand, you can move your hand whenever you want. But involuntary, it means you cannot control. I will say decrease your cardiac rate, decrease your respiratory rate, decrease your digestive secretions. Then you will say, sir, I cannot increase or decrease because these are involuntary in nature. But voluntary, you can control. Whenever I will say, raise your hand, raise your finger, then you can. But if I will say increase your cardiac rate, you cannot because it is involuntary. So anal canal or anal sphincter, which is your external as well as internal sphincter. Internal sphincter, which is involuntary, means contraction and relaxation. It depends upon the fecal matter. Whereas external sphincter, that is voluntary, you can contract or relax your external sphincter. The process of releasing fecal matter from the body, that is known as defecation. It means whenever you pass your stool, that is known as defecation. It means process of releasing fecal matter from the body is known as defecation or bowel movement. Defecation or bowel movement basically depend upon your peristaltic movement. It means whenever you increase the peristaltic movement or increase peristaltic movement, patient may suffer with diarrhea, and in case of constipation, peristaltic movement is decreased. मूसा बैठ के देख आ रहे हैं तो हो जाए लेक्चर accessory organ are related to your digestive system, that is your gallbladder, liver, pancreas. So I said to you that these points is very important related to your anatomy as well as terminology, medical terminology, because in your anatomy portion also you will study about oral cavity, how the food digested, role of accessory organ, structure of stomach, small intestine, large intestine, role of esophagus. So accessory organs, that is your gallbladder, liver, pancreas, they play an important role for the digestion of food. Liver, which forms bile or substance that is known as bile, and that bile is very important for emulsify or mechanically you can say breakdown of food, specifically fats, into a smaller particle so that they can be chemically digested. I want to give you one example. If any patient or any person is suffering with the deficiency of hepatitis C or hepatomegaly, it means the size of liver is increases of fatty liver. These are some disorders or deficiency related to liver. At that time, patient cannot digest food properly, or doctor advised to take only the boiled food because liver secretes bile, and that bile is responsible for digestion of fats or breakdown of fats into a small particle. After that, that fat is chemically digested by bile or digested by your body. Basically, the bile is composed of bilirubin, and that bilirubin is a waste product formed by the normal breakdown of hemoglobin. So, if you will see the diagnostic report of any person's LFT liver function test, then bilirubin, direct bilirubin, total bilirubin count mentioned in that diagnostic report. If, if the level of bilirubin is increased, first you will say bile is composed of bilirubin, the waste product from the normal breakdown of hemoglobin. Everyone knew about that. RBC's lifespan is 120 days. So breakdown of hemoglobin in RBCs at the end of their lifespan, and cholesterol, a fatty substance found only in animal tissue. Bile is released from the liver through your right as well as left hepatic duct. It means your both liver, right liver as well as left liver duct, is responsible for the release of bile, and bile is composed of bilirubin, which is the waste product that is formed from the breakdown of hemoglobin in RBCs at the end of lifespan of that RBCs. Right and left hepatic duct which join to form hepatic duct, and the cystic duct carries bile, and from your gallbladder, when the hepatic and cystic duct, liver and one duct from your gallbladder merge into or common merge into a single duct that is known as common bile duct, which empty into the duodenum. It means that that bile as well as your gallbladder which into a common bile duct, and that empty into the duodenum. Collectively you can say all these ducts is known as bile vessels, bile is stored in your gallbladder, a small sac which is found underside the right lobe of your liver. So your gallbladder which is present you can say right lobe of liver, and where your bile secretion is stored. So basically you can say bile is stored in your gallbladder, and gallbladder which is found on the right lobe of your liver. When fatty food like butter, ghee or meats enter the duodenum, a hormone which is known as cholecystokinin is secreted, and that cholecystokinin causing a contraction of gallbladder to move bile out into the cystic duct. It means whenever you intake more fatty food and that food enters your duodenum, at that time a hormone which is known as cholecystokinin is secreted that causing a contraction in your gallbladder. Why it causing contraction in your gallbladder? Then you will say by releasing or moving bile out into the cystic duct, then the common bile duct, and finally enters that bile into the duodenum. Last one, that is your pancreas. That pancreas is present in your upper left quadrant. Upper left quadrant, it means whenever you cut your stomach into four part, that left upper part which is known as upper left quadrant, where your pancreas is present, and that pancreas is responsible for the digestion of food molecules like carbohydrate, proteins, as well as lipids. Pancreatic enzymes which are carried through the pancreatic duct and which empty into stomach, which empty into the common bile duct. Pancreas, a pancreatic juice is responsible for digestion of food from your exocrine gland. So basically you can say in your pancreas there are of two types of gland, pancreatic gland or exocrine gland as well as endocrine gland. Exocrine gland, that is responsible for the release of enzymes or pancreatic enzymes which is responsible for digestion of carbohydrate, protein as well as fat or lipids. Whereas endocrine gland that secrete insulin directly into your blood and by which your blood glucose level maintain. If the level of insulin or if the level of insulin secretion is decreases, may be due to the destruction of beta cell or may be due to resistance of insulin, patients suffer with hyperglycemia or diabetes mellitus. So these are the accessory organs that play very important role in digestion of food. In next lecture, I will explain about the pathology. It means I will explain about the terminology which is used in different diseases. In different disease are related to your digestive system, like ascites. It means you can say, sir, whenever intraperitoneal fluid, IP or intraperitoneal, whenever intraperitoneal fluid, IP or intraperitoneal fluid, is increases or excessive increase of IP fluid. Diarrhea, it means abnormal discharge of watery or semi-solid stool. Dysphagia, or you can say it means difficulty with swallowing of food. I'll explain it in next lecture about the pathology or terms related to terms which is define the different diseases related to your digestive systems. So I want to conclude it in Hindi right now within 10 minutes, and after that if you have any question feel free to ask. देखिए जैसा कि टर्मिनोलॉजी जिसकी वजह से हमको पढ़ने में आसानी रहे और हम चीज़ों को आसानी के साथ समझ सकें, इसमें हम आपको एक्सप्लेन करेंगे फंक्शन डाइजेस्टिव सिस्टम के। वेरी इंपॉर्टेंट है, ऐसे इसको पढ़िए और सुनिए कि ये आपके एनाटॉमी के पोर्शन में भी हेल्पफुल हो। बोला कि फंक्शन ऑफ द डाइजेस्टिव सिस्टम के बारे में मैं आपको बताऊंगा, साथ में एनाटॉमी एंड फिजियोलॉजी इसकी बताऊंगा, और नेक्स्ट लेक्चर में आपको पैथोलॉजी के बारे में बताऊंगा। और इसके ऑब्जेक्टिव जैसा कि मैंने आपको बताया था कि आप टर्म्स को रिकॉग्नाइज करेंगे रिलेटेड टू एनाटॉमी एंड फिजियोलॉजी ऑफ डाइजेस्टिव सिस्टम। नेक्स्ट लेक्चर में आप टर्म्स को रिकॉग्नाइज करेंगे जब हम पैथोलॉजिकल टर्मिनोलॉजी के बारे में बात करेंगे। तो सबसे पहले हमने फंक्शंस के बारे में बताया था आपको कि जो डाइजेस्टिव सिस्टम है वो वेरी इंपॉर्टेंट है कि उसी की वजह से न्यूट्रिएंट्स प्रोवाइड हम करते हैं या हमारी बॉडी प्रोवाइड करती है सेल्स को, जिसकी वजह से सेल्स रेप्लिकेट करता है और नए सेल या नए टिश्यू का फॉर्मेशन होता है। बोला कि डाइजेशन के लिए कुछ प्रोसेस हैं, जैसे कि इंजेशन, इनटेक ऑफ फूड, डाइजेशन, मैकेनिकल एंड केमिकल ब्रेकडाउन ऑफ फूड को कहते हैं, एब्जॉर्प्शन जिसको कहते हैं प्रोसेस ऑफ एक्सट्रैक्टिंग, एक्सट्रैक्ट कर लेना, जैसे आपने चाय बनाई उसको छान लिया, वो दैट इज नोन एज द प्रोसेस ऑफ एक्सट्रैक्शन। तो यहाँ पे इन्होंने बोला कि हमने फूड लिया, उसमें से कार्बोहाइड्रेट, प्रोटीन, फैट एक्सट्रैक्ट आउट हो गया और वेस्ट प्रोडक्ट जो है वो इन फॉर्म ऑफ स्टूल हमने रिलीज कर दिया टॉयलेट में। इसके बाद बोल रहा है कि एलिमिनेशन होगा, वेस्ट प्रोडक्ट को हम लोग एलिमिनेट आउट करेंगे। डाइजेस्टिव सिस्टम को बोल रहा है कि कुछ और टर्मिनोलॉजी दी गई है, जैसे कि आपके जीआईटी है, एलिमेंट्री कैनाल है, ये टर्म्स यूज किए गए हैं। इसके बाद है ओवरव्यू, अगर मैं कुछ बताऊं आपको डाइजेस्टिव सिस्टम जो कि बिगिन शुरू हो रहा है फ्रॉम योर ओरल कैविटी, पासेज इनटू योर थोरेसिक कैविटी। इसमें आपको मेडिस्टनम के बारे में बताया था कि मेडिस्टनम, प्लूरल कैविटी, कार्डियल, पेरिकार्डियल कैविटी, मेडिस्टनम में आपके ट्राइकिया, इसोफेगस थे, वही बोला कि मेडिस्टनम को क्रॉस कर रहा है, देन डायफ्राम को और आपके एब्डोमिनोपेल्विक कैविटी में आ रहा है, फाइनली एग्जिस्ट कर रहा है आपके एनस में। कुछ ग्लैंड्स पाए जाते हैं जो कि डाइजेशन में हेल्प करते हैं, जैसे कि आपको बताया अभी लीवर है, गॉल ब्लैडर है, पैंक्रियाज है, इनके अलग अलग रोल हैं और वो उसी हिसाब से अपना रोल प्ले करते हैं डाइजेशन में हेल्प करने के लिए। पेरिस्टाल्टिक मूवमेंट आपको बताया था कि अगर ज्यादा होगी, ज्यादा बढ़ जाएगी तो पेशेंट सफर करेगा डायरिया से, पेरिस्टाल्टिक मूवमेंट कम हो जाएगी तो पेशेंट सफर करता है कॉन्स्टिपेशन से। इसीलिए देखिए जब कॉन्स्टिपेशन होती है तो स्टूल हमेशा ड्राई होता है, ड्राई होने की वजह रफ होता है क्योंकि उसमें वाटर का कंटेंट कम हो जाता है। उठ के बैठो, वाटर का कंटेंट कम होता है। बोला कि जो ओरल कैविटी में आपने फूड लिया, आपने एक बाइट ली, दैट बाइट क्या हो रहा है, ब्रेक डाउन हो रहा है उस फूड का, मैकेनिकली आप चीव कर रहे हैं, दांतों से आप चबा के खा रहे हैं, दैट इज नोन एज मैस्टिकेशन। आफ्टर दैट उसी में आप बोलेंगे कि लुब्रिकेट दैट फूड टू मेक सॉलोइंग। अब देखिए मुंह में जो ये स्मोक बन रहा है, उसकी वजह से आपका फूड आसानी से आप स्वॉलो कर ले रहे हैं, उसको डेग्लूटिशन बोलते हैं, आसानी से निगल ले रहे हैं। अगर वही लुब्रिकेट नहीं होगा तो आप कहते हैं कि खाना अटक रहा है, सूखा है, गले में फंस रहा है। इसके अलावा इसमें आपको ओरल कैविटी के बाद मैस्टिकेशन है, फूड वो आपका स्वॉलो करने के बाद आपके स्टमक में आएगा। उससे पहले मैंने आपको टॉन्सिल के बारे में बताया था कि टॉन्सिलाइटिस हो जाती है, इन्फ्लामेशन हो गया है टॉन्सिल में। जनरली टॉन्सिल, अगर मैं लोकेशन की बात करता हूं तो आप बोलेंगे बेस ऑफ द टंग। फिजिकली अगर कभी आपको गले में दर्द हुआ है, स्वेलिंग आ गई है, तो डॉक्टर आपके यहाँ बेस में चेक करता है या अपर नेक के रीजन में देखता है, तो यहाँ पे अगर इन्फ्लामेशन है तो वो अलग से दिख रहा होगा, उसको डॉक्टर बोलता है टॉन्सिलाइटिस हो गया है। एंड आफ्टर दैट डॉक्टर प्रिस्क्राइब एजिथ्रोमाइसिन और एंटीबायोटिक ड्रग्स। बोला कि सॉफ्ट पैलेट एंड हार्ड पैलेट आपके ओरल कैविटी में पाया जाता है। अब देखिए, यूबुला जिसको हम लोग आप देख सकते हैं बीच में हैंग कर रहा है, मिडिल पोर्शन में वो एक गोश्त का टुकड़ा है, फ्लैश है। इसका मेन काम है, जो आवाज ये निकल रही है प्रोडक्शन ऑफ स्पीच के लिए। एंड सॉफ्ट पैलेट पीछे की तरफ मौजूद है, वहां पे आपका यूबुला मौजूद होता है, पाया जाता है। इसी तरह बोला कि आपके ओरल कैविटी में अपर एंड लोअर जॉ है। अपर को बोलते हैं मैक्सिला, जबकि लोअर जॉ को बोलते हैं मैंडिबल, जो कि नियर अबाउट 32 परमानेंट टीथ को गम्स में, फ्लैशी गम में वो सेट रहते हैं। जिंजिवे बोलते हैं इसको, गम्स को। एंड इसके बाद मैंने आपको बताया टॉन्सिल के बाद की जो फूड है आपका, थ्रोट के बारे में बताया कि फेरिंग्स, और जनरली फेरिंग्स में आपको बताया कि फेरेंजाइटिस हो जाता है, इन्फ्लामेशन होता है। फेरिंग्स से पहले आपको बता दें कि जो सिक्रीशन हो रहा है उसकी लोकेशन क्या, जो ग्लैंड्स प्रेजेंट है आपके ओरल कैविटी में, पैरोटिड ग्लैंड, सब मैंडिबुलर ग्लैंड एंड सब लिंगुअल ग्लैंड की बात कर रहा हूं। इनके आपको मैं लोकेशन बता दूं। नंबर 1, पैरोटिड ग्लैंड नियर टू योर एयर, कान के नीचे पाया जा रहा है। सब मैंडिबुलर, जो कि अंडर द लोअर जॉ, ये नीचे वाले जॉ के नीचे है। जबकि सब, जो फेरेंजाइटिस वर्ड यूज किया जाता है जब भी आपको कफ हो रहा है या लगता है कि गले में खराश है, इचिंग हो रही है, एट दैट टाइम डॉक्टर आपको, देखिए कफिंग हो रही है तो डॉक्टर आपको सिरप दे रहा है, कफ सिरप। वो वहां पे एक प्रोटेक्टिव लेयर उस इन्फ्लेम्ड एरिया में बना लेता है, जिसकी वजह से आपको सूदिंग इफेक्ट मिलता है, आपको आराम मिल जाता है। इसके बाद बताया था कि फेरिंग्स जो है, नेजोफेरिंग्स, ओरोफेरिंग्स एंड हाइपोफेरिंग्स, जिसको लैरेंजियोफेरिंग्स कहते हैं, इसमें डिवाइड किया गया है। देन इसोफेगस की बात आती है। फेरिंग्स और थ्रोट के बाद आपके हम जो बात कर रहे हैं आपके इसोफेगस के बारे में। वो इसोफेगस जो है 12 इंच का साइज है, ट्यूब लाइक स्ट्रक्चर है, जो कि आपके थ्रोट और स्टमक के बीच में एक कनेक्टिविटी है, एक पाइप है जो कि मस्कुलर है, म्यूकस लाइंड है। और ये पाइप, ये जो इसोफेगस है, विच इज रिस्पॉन्सिबल फॉर कैरिंग मैस्टिकेटेड लंप ऑफ फूड, जिसको हम लोग बोलस कहते हैं, वो इसोफेगस आपके मुंह से या ओरल कैविटी से उस बोलस को आपके स्टमक में पहुंचाता है। और इसोफेगस जो है, बस बस विद इन 10 मिनट्स इसोफेगस, हाँ 10 मिनट, जो फूड आपके स्टमक में पहुंचा रहा है। देन इसके बाद मैं आपको इसमें बता दूं कि स्टमक का क्या रोल है। स्टमक का मेन, आप सबसे पहले स्ट्रक्चर बताएंगे कि सैक लाइक वेसल, इसका स्ट्रक्चर है जो कि आपके इसोफेगस और स्मॉल इंटेस्टाइन के बीच में पाया जाता है। इसका मेन काम है कि प्रोटीन के डाइजेशन के लिए मेन काम है, जो फूड है आया है बोलस, उसमें कोटिंग करना, कवरिंग करना या मिक्सिंग करना विद गैस्ट्रिक जूस एज वेल एज एचसीएल के साथ। जैसे ये मिक्स हो जाता है, प्रोटीन डाइजेस्ट होता है, ये बोलस कन्वर्ट हो जाता है काइम में। और इसके बाद आपको बताया था कि जो स्टमक है वो 3 पार्ट में डिवाइड किया गया है, फंडस, बॉडी एंड पाइलोरस। फंडस अपर पार्ट है, बॉडी मिडिल पोर्शन है, पाइलोरस डिस्टल पार्ट है, नीचे का पोर्शन है। स्टमक में आपको बताया था कि जो ऊपर का पोर्शन है फंडस, वहां पे एसिड का सिक्रीशन नहीं होता है। इसके अलावा आपको बताया था कि पाइलोरस या पाइलोरिक है, उसको फिर सब डिवाइड किया गया, पाइलोरिक एंट्रम में, पाइलोरिक कैनाल में एंड पाइलोरिक इंस्पेक्टर में। पाइलोरिक इंस्पेक्टर तब ओपन होता है, रिलैक्स होता है, जब आपका काइम स्मॉल इंटेस्टाइन में एंटर करता है। अब उसके बाद क्या है, स्मॉल इंटेस्टाइन के बारे में आपको थोड़ा सा बता दूं कि स्मॉल इंटेस्टाइन में काइम जब स्टमक से स्मॉल इंटेस्टाइन में आता है तो पाइलोरिक स्पेक्टर रिलैक्स होता है, आपका फूड या काइम वो स्मॉल इंटेस्टाइन में आता है, फिर आपका इंस्पेक्टर जो पाइलोरिक इंस्पेक्टर है वो कॉन्स्ट्रिक्ट हो जाता है। तो बोल रहा है कि स्मॉल इंटेस्टाइन का फर्स्ट पार्ट है ड्यूडेनम, वहां पे आपका फूड आया काइम के फॉर्म में। यहाँ पे स्मॉल इंटेस्टाइन में आपका जो फूड खाया था काइम, वहां से एब्जॉर्प्शन हो जाएगा कार्बोहाइड्रेट, प्रोटीन और लिपिड्स का। जो बचा हुआ होगा वो फिर इसके बाद पास होगा आपके लार्ज इंटेस्टाइन में। हाँ, स्मॉल इंटेस्टाइन कह दो, बस 5 मिनट में हम छोड़ रहे हैं, कह दो 5 मिनट, 5 मिनट में देखो। स्मॉल इंटेस्टाइन है वो आपका साइज 20 फीट है, लेकिन जो डायमीटर है वो कम होता है, इसीलिए इसको स्मॉल इंटेस्टाइन है। सरफेस एरिया ज्यादा है, एब्जॉर्प्शन ज्यादा होता है। बस 2 मिनट बेटा। इसके बाद आता है स्मॉल इंटेस्टाइन के बाद लार्ज इंटेस्टाइन। इस लार्ज इंटेस्टाइन में बेसिकली आप बोलेंगे कि एब्जॉर्प्शन नहीं होता है, क्योंकि विलाई मौजूद नहीं है। विलाई ना होने की वजह से एब्जॉर्प्शन नहीं होता है। लेकिन लार्ज इंटेस्टाइन में आप बोलते हैं कि कुछ प्रोटीन्स है, कुछ विटामिन्स है, उनकी सिंथेसिस होती है। अदरवाइज ये लार्ज इंटेस्टाइन का मेन काम है कि वेस्ट प्रोडक्ट को आपके बॉडी से एक्सक्रीट आउट करा दे। डायमीटर वाइडर होता है, लार्ज इंटेस्टाइन का साइज अबाउट 5 फीट है, लेकिन वाइडर डायमीटर की वजह से इसको लार्ज इंटेस्टाइन कहते हैं। अपेंडिक्स पाया जाता है। इन जनरल अपेंडिक्स का डाइजेस्टिव सिस्टम में कोई रोल नहीं है, बट वी थॉट हम की बाइल के सिक्रीशन के लिए रिस्पॉन्सिबल है बिलीरुबिन से। बाइल इज कंपोज ऑफ बिलीरुबिन, वेस्ट प्रोडक्ट जो आपका है डाउन होता है हेमोग्लोबिन का, आरबीसीज का, और कोलेस्ट्रॉल ये पाया जाता है। अब इसके बाद बोल रहा था कि हेपेटिक डक्ट और सिस्टिक डक्ट एक जगह बाइंड करते हैं। सिस्टिक डक्ट आपके गॉल ब्लैडर से आ रहा है, हेपेटिक डक्ट आपके लीवर से आ रहा है। जहां पे ये बाइंड ज्वाइन करते हैं उसको कॉमन बाइल डक्ट कहते हैं, और इसी को हम बाइल वेसल्स भी कहते हैं। बोला कि गॉल ब्लैडर में आपके बाइल का स्टोर होता है, लेकिन जब हम फैटी फूड खाते हैं, बटर, घी, मक्खन या मीट, उस टाइम गॉल ब्लैडर से हमारा जो बाइल स्टोर है वो रिलीज होता है और वो डाइजेशन के लिए फुल होता है। इसके अलावा हमने आपको बताया था कि एक हार्मोन है कॉलिसिस्टोकाइनिन, वो भी रिलीज होता है, जो क्योंकि वो कॉलिसिस्टोकाइनिन डाइजेशन में हेल्प करता है। फिर कॉन्ट्रैक्शन ऑफ गॉल ब्लैडर के लिए, क्यों, जब गॉल ब्लैडर को कॉन्ट्रैक्शन होगा तो रिलीज ज्यादा के बाइल का, ये काम है कॉलिसिस्टोकाइनिन के, सिस्टोकाइनिन का। पैंक्रियाज लास्ट में बताया था आपको कि लेफ्ट क्वाड्रेंट में पाया जा रहा है। अब ये मेरा स्टमक है, लेफ्ट अपर पोर्शन की बात कर रहा हूं, तो ये लेफ्ट अपर पोर्शन है आपका। अगर मेरा स्टमक दिख रहा होगा आपको, यहाँ से लेफ्ट साइड से आपके सिक्रीशन हो रहा है पैंक्रियाज का, पैंक्रियाटिक जूस निकल रहा है, जो कि हेल्पफुल है कार्बोहाइड्रेट, प्रोटीन और लिपिड के डाइजेशन के लिए। इसके बाद हमने बताया था कि पैंक्रियाज से एक्सोक्राइन इज रिस्पॉन्सिबल फॉर डाइजेशन ऑफ फूड पार्टिकल्स, gland release beta from beta cell inhibition and maintain your blood glucose level. Thank you class, thank you all. आज बस इतना इनफ है। टाइम भी ज़्यादा हो गया क्योंकि मुझे शादी में भी जाना है, बाकी लोग तैयार हो गए। ओके, बाय एंड गुड नाइट। प्लीज़ सीआर जो भी हैं आपके एक शायद बीमार हैं, अल्लाह ताला उनको शिफ़ा दे एंड जो भी हैं सेकंड एक अल्लाह ताला उनको शिफ़ा दे एंड जो भी हैं सेकंड एक गर्ल है, मैं उनसे बोल रहा हूँ कि प्लीज़ वो अटेंडेंस लेके वो मुझे सेंड कर देंगी मेरे नंबर पे। थैंक यू ऑल। प्लीज़ पर्सनल मैसेज मत करिए लाइव चैट में। आप प्रोफ़ेशनल कोर्स में हैं, तो उस डिग्निटी को मेंटेन रखिए प्लीज़। थैंक यू ऑल। थैंक यू वेरी मच।